Hi everyone, and welcome back to What's Z. Today we're diving into the world of cardiology to understand a life-saving procedure called angioplasty. This procedure is crucial for patients suffering from heart diseases, especially those with blocked arteries. In simple terms, angioplasty is like a plumbing job for your heart. Just as a plumber clears out clogged pipes, doctors use angioplasty to clear blocked arteries. Imagine your arteries, the blood vessels that carry oxygen-rich blood throughout your body, as pipes. These pipes are essential for maintaining the health and function of your organs. Sometimes these pipes can get clogged with a buildup of plaque, a fatty substance. This plaque can accumulate over time due to factors like poor diet, lack of exercise, and genetics. This blockage restricts blood flow, much like a clogged pipe restricts water flow. When blood flow is restricted, it can lead to serious health issues, including heart attacks. Angioplasty comes to the rescue by clearing these blockages and restoring smooth blood flow to your heart. The procedure involves inserting a tiny balloon into the artery and inflating it to push the plaque aside. It's a minimally invasive procedure, meaning it's done through a small incision, typically in the groin or arm. This makes the recovery time much shorter compared to traditional surgery. You might be wondering, why is this procedure so important? Well, when plaque builds up in your arteries, it can lead to a condition called atherosclerosis, also known as hardening of the arteries. Atherosclerosis is a serious concern because it restricts blood flow to vital organs, including your heart. This can cause chest pain, shortness of breath, and in severe cases, a heart attack. Angioplasty helps prevent these complications by clearing the blockage and restoring blood flow, ensuring your heart gets the oxygen it needs to function properly. It's a game changer for countless individuals, improving their quality of life and even saving lives. Angioplasty isn't for everyone, of course. It's typically recommended for individuals who have a significant blockage in one or more coronary arteries, the blood vessels that supply blood to the heart muscle itself. Your doctor might recommend angioplasty if you experience symptoms like chest pain, angina, have had a heart attack, or are at high risk for heart disease. Factors like high cholesterol, high blood pressure, diabetes, smoking, and family history of heart disease can increase your risk. If you're concerned about your heart health, it's crucial to talk to your doctor, who can assess your individual risk factors and recommend the best course of action. Inside the procedure, a step-by-step guide. Let's walk through what you can expect during an angioplasty procedure. This minimally invasive procedure is designed to open up blocked or narrowed arteries, improving blood flow to your heart. First, you'll receive local anesthesia to numb the area where the catheter, a thin, flexible tube, will be inserted. This ensures that you remain comfortable throughout the procedure. The doctor then carefully guides the catheter through your blood vessels to the site of the blockage, using advanced imaging techniques to navigate. A tiny balloon at the tip of the catheter is then inflated. This action compresses the plaque against the artery walls, effectively widening the narrowed passage and restoring better blood flow. In many cases, a stent, a small expandable metal mesh tube, is also placed in the artery. This stent helps to keep the artery open long-term, reducing the risk of future blockages. The entire procedure typically takes less than an hour. Most patients can return home the same day or the next day, allowing for a quick recovery and minimal disruption to daily life. Angioplasty by the numbers, facts, and figures. In this section, we will delve into the critical statistics and data surrounding angioplasty procedures. Now, for some interesting facts and figures. These numbers highlight the significance and impact of angioplasty in modern medicine. Did you know that over 1 million angioplasty procedures are performed in the United States each year? This makes it one of the most common medical procedures in the country. It's a common and highly effective procedure with a success rate of over 90%. This high success rate is a testament to the skill and expertise of the medical professionals involved. Angioplasty has been shown to significantly reduce the risk of heart attack, stroke, and other cardiovascular events. Patients who undergo this procedure often experience a marked improvement in their overall heart health. Thanks to advancements in medical technology, angioplasty has become even safer and less invasive over the years. These technological improvements have made the procedure more accessible and less daunting for patients. It's a testament to the incredible progress in the field of cardiology and the dedication of healthcare professionals to improving patient outcomes. The continuous research and development in this field are truly remarkable. That's it for our deep dive into angioplasty. We hope this information has provided you with a clearer understanding of the procedure and its benefits. We hope you found this information helpful and insightful. Remember, knowledge is power when it comes to your health. If you have any questions or want to suggest medical terms you'd like us to explain, feel free to leave a comment below. We value your feedback and are here to help. Stay tuned for more health-related topics on What's Z. We are committed to bringing you the latest and most relevant health information. Until next time, stay informed and stay healthy. Your well-being is our priority.